introducing the next session, which is there anything purer than cotton wool and water? And this is an examination looking at babies' newborn skin. And I'm delighted to introduce Margaret Merrigan-Feenan, who's a clinical midwife manager, antenatal educator, and family planning counsellor. And she manages the parent education department at Europe's busiest maternity hospital. I bet there would be a debate about that from some of you watching. Margaret's had over 40 years experience working in this field. I can't believe that. It can't be that long. And she runs private antenatal classes. She's worked extensively with the Irish Multiple Birth Association. She's had articles published in medical journals and magazines, and she has appeared on TV3's Ireland AM offering. And she's been doing parenting advice on baby-related topics from breastfeeding to bathing. So I'm delighted that she's been able to join us this afternoon. So welcome, Margaret. Now, I must say the screen is yours.
Well, there we are. Thank you so much, Sue, for that introduction. It's a great honour and privilege to be given the opportunity to present at the London Maternity and Midwifery Festival. I would like to start with a short poll, just 4 short questions. And it's around the advice that we give parents when cleaning a baby's nappy area. So it should be coming on the screen now. So all you have to do is press the submit button, and here are the questions. When asked by parents for advice on cleaning a baby's bottom, which of the following best describes what you say? A, would that be cotton wool and water? Is it to use any baby wipe? Or number C, use specific minimal ingredients or non-medicated wipe? Or D, I do not give advice on this topic. So if you could put those in, just press the submit button. I will get the results later. And while you're doing that, I'll go on to tell you what my objectives for today are. So it's going to be number 1, understanding maybe or talking a little bit more about the difference between baby skin and adult skin. To talk a tiny bit about nappy rash, to identify if there's anything purer than cotton wool and water, and then to share with you the latest research, the basic study from Salford University. So the difference between baby skin and adult skin. And I think we've known for years that there has been a big difference. And this slide shows you that comparison quite clearly. The skin is the largest organ of the body, and it's the first to develop even within the womb. So it continues to develop over the baby's first 12 months. It consists, as you can see there, of the 3 layers, the epidermis, the dermis, and then the subcutaneous fatty tissue. The epidermis then is subdivided into 5 layers. The epidermis in babies is 20% thinner than in adults. And the top layer, the stratum corneum, is 30% thinner in babies. So the skin's primary function is a protective layer that maintains hydration and electrolytes while preventing the entry of bacteria, pollutants, allergens, and particulates. And we help start this process as midwives when babies have skin-to-skin contact immediately after birth. That has been shown particularly to increase a newborn baby's skin hydration, but it also enables the colonization of the baby's skin by the mother's friendly bacteria. And that also helps, of course, to protect the baby against infection. So this back to the stratum corneum. Can't see my mouse, so I'll leave that, but you can see it there clearly. The stratum corneum provides strong resistance to water transport across the skin. But babies have a higher tendency to for increased transepidermal water loss. And that, of course, is due to their less effective skin barrier. The skin barrier is renewed through epidermal differentiation when cells migrate up to the top of the stratum corneum. And that process takes 28 days until it's shed again. Another interesting thing between baby skin and adult skin is that the baby body surface to the baby's body weight is much higher than an adult's. And then for that reason, it means topical agents are much more readily absorbed and therefore may have a more pronounced effect on the baby skin. As the pH level in baby skin is higher, the skin therefore is more vulnerable to infection and especially nappy rash. So you can see as healthcare professionals, we are always trying to advise of best care for baby skin. And most babies are born with just beautiful, silky, soft skin. But then sometimes nappy rash can appear. And nappy rash may be described as the common inflammation of the bottom, genitals, and groin area of a baby. And it can range from a mild irritation to a very painful infection. So on your screens now, you see a baby's bottom there that is really inflamed, really sore. And I suppose for healthcare professionals working in this area, it is one of the commonest skin complaints that we see in baby. And of course, that's not surprising, because if you think of the length of time a baby spends wrapped up in nappies and their skin in constant contact with urine and fetal matter. But nappy rash is very uncomfortable for a baby. It can also be a portal of entry for bacterial infection. And then, of course, that increased family healthcare costs. If a baby was hospitalized for any reason and they developed nappy rash, that will also then increase the length of stay in hospital. It is common in neonatal intensive care units or special care units. Nappy rash can have a rating of 40%. And especially, I suppose, if the baby has NAS, which should be the neonatal abstinence syndrome or the short gut syndrome, where diarrhea can be troublesome. And again, if you think that the mainstay of babies in intensive care units are premature babies have much thinner and more sensitive skin, again, than the full-term baby, and therefore more prone to irritation. The latest research from the UK then in babies aged 0 to 8 weeks shows a nappy rash rate of 25%, which probably sounds quite high, but it is the latest research from 2020, which I'll share with you at the end. So this chart is showing you a nappy rash scoring from 1 to 5. Now, different health services have different charts and different scores, but I feel it would be best practice if we had a standard graph. So therefore, when it comes to nappy rash, we could make the same diagnosis and advise the same treatment. I think nothing confuses parents, and especially first-time parents, more than healthcare professionals giving different advice, and a lot of time on the same topic. So this one is graded 1 to 5. So you can see grade 1, what I mentioned there. This baby has beautiful, soft, silky skin, and this is a full-term baby. Grade 2 would show you some redness and a mild rash. But when you get to number 3 there, I think you can see that the skin is shiny and that it is broken. And discomfort is evident. You can imagine when that baby has a bowel motion or wets himself with the urine, that will sting, and it's really uncomfortable. Grade 4 and 5 are obviously a lot more severe. Yes, thank you. Right. So I've just got the results of the poll that I asked at the beginning. Whether you would recommend a baby wipe, whether you would recommend cotton wool and water, or you wouldn't give a recommendation. So Catherine has just given to me results. 71% of you said you'd recommend cotton wool and water, and 28% they would recommend any baby wipe. So that probably brings me to my next slide, that we will take a look at wipes. So I'm sure by looking at this, you see some brands that are jumping out at you there that you recognize. And I think you can also clearly see that there are a varying amount of ingredients in them all. Now, these would all say that they're suitable for newborns. And I think as healthcare professionals, in my role especially, I'm asked for advice about using wipes. But we don't have time to be investigating all the different brands and what their ingredients are. But I do feel that when parents ask for advice, there is an onus on us to be aware of what the latest evidence and research is on the products, just helping parents to keep their baby's skin healthy and prevent the development of skin conditions. And that includes, of course, atopic dermatitis as well as nappy rash. So looking at this slide, you see how many ingredients there are. There can be anything from 2 up to 16. So standard wipes have something like 16 different ingredients. Even the sensitive wipes, which is surprising, have 15. What are marketed as natural wipes contain something like 10 ingredients, pure wipes 7. And you can see the water wipes have just 2. So we should be advising to use only products that don't affect the skin barrier, that are pH neutral, are fragrance free, alcohol free, and only contain a mild preservative with minimal ingredients. So basically, we're telling parents to read the labels, to know what they're putting on their baby's skin, and that it has been well researched and documented. So bringing me on to my next point then, is there anything purer than cotton wool and water? Well, in March 2020, WaterWipes were awarded accreditation from the Skin Health Alliance. The accreditation process involves conducting an independent review of the products in order to support the safety and efficacy of the products. Now, the Skin Health Alliance are a leading international skin health organization, and they work with dermatologists and scientists and the skin care industry with a common interest in the promotion of healthy skin. Ultimately, their aim is to reassure parents that products have been independently verified as skin safe. They reviewed WaterWipes research, including a thorough assessment of the ingredients, of their clinical trial data, and their proof of efficacy. So 2 key areas were looked at in detail, and that was cotton wool and water purity. So the cotton wool was looked at from the meaning of the word to the description of cotton wool, and then the process of manufacture. On the other hand, water was looked at to the different types of tap water, the impurities in it, what is left after you boiled water, and then they examined the process used by WaterWipes. So the cotton wool, every aspect of cotton wool was looked at in detail, as I said, from the meaning to the word to the manufacturer. So the meaning of the word pure, that means it's not mixed with any other substance or material, and it's free from any contamination and without any unnecessary elements. whereby the word purer would be used when comparing two or more items. The items that display the greatest extent of purity could be claimed to be purer than others. So this slide I have up now is showing you the production of cotton wool. And I think we all know that the cotton wool we buy in the shop is 100% typically cotton, and it comes in various formats like cotton wool balls, pads, rolls, etc. But it started life in the fields, in the cotton fields, and it's collected by hand, and then it goes through a 9-step manufacturing process. And that's what this slide is showing you, that it starts by opening and cleaning the lint, and the foreign substance are removed. So that would be, there'd be little bits of husks and leaves and seeds. You can imagine when it's picked in the field that it can contain little bits of different material. Then it is loosened, it's boiled, and it's washed with caustic soda to remove the waxes and oil. The second stage will be bleaching, and the bleaching removes the brown colouring, and the brown colouring will be from the chemical treatment of the raw cotton. So the bleaching agents, something like hydrogen peroxide, are used to make the cotton whiter and more hydrophilic. Then the chemicals have to be removed and the cotton is neutralized, and it's neutralized using a diluted solution of hydrochloric acid or sulfuric acid. And that will reduce the alkali properties. Then it is dried, then it is opened and set into laps, and then it goes through a carding machine. And the carding machine wraps it into thin layers. Then it is rolled, and then it is cut and weighed, and it's packaged. So you can see it's a long process, but at the end of all that, the final product, despite its complex process, there's no way to guarantee that it's sterile in its final pack. Small little pieces of cottonseed or other impurities can still be found in the final product, and you'll sometimes get a little warning on the pack of that. So hence the cotton wool we buy cannot be completely free from contamination, and so in this instance it does not fulfill the definition of pure as explained, nor mixed with any other substance or material, and free from unnecessary contamination. So comparing the water, WaterWipes use a 7-stage purification method in their manufacture of the WaterWipes. And that means that there is a deeper and more effective clean. So looking at the water purity slide here, you can see 6 different cylinders. And starting over at the immediate left, your left, there is a cylinder of typical raw water. And you can see by what's written underneath there that it may contain dissolved minerals, salts, pollutants, insoluble materials or bacteria, inorganic contaminants such as salt and metals, organic chemicals from industry. So even typical tap water may contain chlorine, copper, fluoride, lead, zinc, and that would be in countries where the water is drinkable from the tap. And we know that a lot of our parents would use typical tap water to clean babies. So the best option would be boiled water. But unfortunately, I know when parents go home from hospital, they don't use boiled water. Now, boiling water is one of the most effective ways to eliminate impurities. Although it removes microbes, it cannot remove certain chemicals or impurities, maybe like dust or dirt or mud. And it's never, therefore, completely free from chemical impurities. There might be trace elements of lead, arsenic, and magnesium salts. Typical bottled water that is so popular and most of us will drink goes through a 3 to 4 stage process. Sterile water is usually made for or reserved for medical use, but the water that WaterWipes use is the purest there is, because at the end result of the skin is cleansed much deeper and more effectively, and without the need for adding additional cleansing agents that you will find in other wipes, just as I've demonstrated all the ingredients. The majority of other wipes use surfactants in their products to reduce the surface tension. And surfactants are compounds used in soaps, detergents, lubricants, and other emulsifiers. And when they're added to a liquid, they reduce its surface tension. So reducing the surface tension of water will help improve the wetting surface. And that's obviously, as I said, key to getting a better clean. And you can see from this slide what I mean by that. So in the one on the immediate left, the typical skin surface of a baby will have the dirt, the urine, and impurities. And then when it's cleaned with tap water, it will remove those on the surface, but it will not get down into those deep crevices where the water, the purified water, will get to. To WaterWipes' credit too, they use clean room conditions in their manufacture. And I suppose that's pretty unique in the wipe industry, because clean room conditions are normally reserved for scientific research used in the pharmaceutical industry, or for instance, in the manufacture of baby formula. And it's a controlled environment with a low level of pollutants, such as maybe airborne microbes or aerosol particles and chemical vapors. Now, this slide just shows you cotton wool before and after, and this is the cotton wool that I use in my practice, where they're quite small, as you can see, and then you can see the end result. But we have this slide up just to show you that there is a risk of contamination if that same piece of cotton wool was dipped into the water more than once. But I suppose healthcare professionals wouldn't be doing that. But if you're dipping your fingers after touching that soiled cotton wool back into the water, there is a risk of contamination. So the Skin Health Alliance concluded that WaterWipes are purer than cotton wool and water, that they have 99.9% high purity water and a drop of fruit extract. So moving on to my next objective, in 2020, there is a new UK study on the incidence and rate of nappy rash in full-term infants using 3 different types of baby wipes. So the study I referred to was the Baby Skin Integrity Comparison Study, which is BASICS. Now, this was a midwifery-led study carried out by the School of Health and Society in the University of Salford and Greater Manchester, and it was published in the Pediatrics and Neonatology Journal in October 2020. And it revealed that different formulations of wipes can impact the skin integrity of newborns. The study compared the incidence and duration of nappy rash on full-term infants 0 to 8 weeks of age using 3 different brands of baby wipes. Now, they were all marketed as suitable for neonates and containing a varying number of ingredients. Now, for many years, we've known that baby wipes have been shown to be safe and effective in maintaining skin integrity when compared to the use of water alone. But however, no previous study compared different formulations of wipes. And the mothers who volunteered for this study were from a diverse mix of ethnic and socioeconomic backgrounds, and they were recruited from antenatal clinics across 3 NHS trusts in Greater Manchester. In total, 698 mothers, that was 97% remained in the study for the full 8 weeks. And they were divided into 3 groups, and each group used a different baby wipe, but the same brand of disposable nappies. So if someone complained baby got nappy rash, it wasn't down to the nappy. So researchers involved now in the analysis of the data were blind to the brand of baby wipe. But obviously the mothers weren't blinded to the type of wipe they were using, because that would have necessitated repackaging the wipes, which could, of course, have compromised the quality of the contents. So these mothers observed the baby's skin on a daily basis using a smartphone app. And the 5-point scale that I showed you earlier of nappy rash, that also came up on their phone as reference. And that allowed the mothers to reflect daily on their baby's skin condition and cleansing routine using real-time methods of data collection. And real-time methods are known to be more accurate than retrospective methods. The 5-point scoring chart was used, and they decided that clinically significant nappy rash was grade 3 or higher. And grade 3 was the one I showed you where the skin had started to break. The percentage of mothers who reported at least 1 day of nappy rash was 24.6%. The WaterWipes brand had the lower incidence of nappy rash than those cleaned with the other brands. So you can see clearly from this slide that 19% of WaterWipes baby had nappy rash. 25% had the leading brand 1 and 30% leading brand 2. So overall, the nappy rash rate score was 1.43. The average number of days with no rash was 34 out of the 55 study days. The babies cleaned with WaterWipes had 1 day of nappy rash compared to the leading brand 2, 1.69 days. So therefore, babies cleaned with WaterWipes had a shorter duration of nappy rash than those with the other 2 brands. So just to share the latest news from WaterWipes is that from the end of January, they will be 100% biodegradable. And they are absolutely delighted to be able to announce that, because they feel parents will no longer have to choose between what's best for their baby's skin and what's best for the planet. Okay, so biodegradable will not mean flushable. Soiled wipes will still have to be disposed of appropriate. But it is great news that they are further researching to be as kind as possible to baby skin and to be also kinder to the environment. So I hope you have found the presentation interesting, and we have a few touch points there for healthcare professionals. So there's 3 ways of getting in touch if you would like. One would be through the website, and if you would like to receive more information or you would like samples, you can again get in touch by email. You could also sign up for the quarterly newsletter, which would contain very interesting articles and keep you up to date on everything that's happening in the world of WaterWipes. So WaterWipes are the purest water wipe there is. So thank you for listening.
Thank you very much, Margaret. That's grand. That's quite a gallop through from nice anatomy and physiology all through to research. That's fantastic. I do have a few questions, but we don't have much time. So I know people will probably contact you at a later point. Karen Devine, hi Karen, agrees, definitely we need a standard scoring chart for nappy rash, and as a neonatal midwife, the treatment the baby gets depends on the doctor there at the time as to what ointment
Yes,
to be given.
yes.
And someone else, so Ola suggests it would be great to see nappy rash examples with children with higher skin melanin content, as sometimes rashes can be harder to notice with darker skin types, and that's a useful
Yes,
point. Thank you.
yes, absolutely.
And then the last question is from Laura Carroll, who says the water wipe is saturated with water and fruit extract, but what is the actual wipe made of? Is this treated, bleached like the wool? If not cotton, but made from different fibres, is there any information on how this is tolerated by newborn skin comparatively? Well, I think you've answered the second bit because you've shared the research. But I think it's the query about whether it's a plastic or a cotton fibre.
No, it's actually 80% polyester and 20% viscose, but the biodegradable ones will be 100% plant-based with no plastics, and there is no plastics currently in the wipe.
No, that's great. I think that's been discussed at other events, because I think we're obviously getting much more sensitive about the planet and plastic. And I guess one day the next step will be to find a container for the water wipes that isn't plastic. I guess that's going to be more of a challenge.
Well, trials are underway to change the packaging.
I thought there might be.
Yes, yes. We're definitely on the ball in Ireland.
Absolutely. Well, thank you very much, Margaret, for sharing what's happening at WaterWipes and the research, and also giving us a reminder of the physiology and anatomy of the baby's skin, because I think that's a really useful thing for us as midwives to understand. And with the changing of the NMC standards, certainly in the UK, we need to understand the newborn and neonate much better. So yes. Thank you very much for being with us today.
You're very welcome, and thank you for having me.